let me just tell you a little bit about LifeBridge Health. Royce touched on it, and what our implementation of Get Well has looked like, because it predates me. As you'll see, Carroll Hospital in 2011 stood up the inpatient solution of Get Well. That predates my tenure here. And in fact, it predates our acquisition of that hospital. What you'll find is that over time at LifeBridge, we've had the benefit of and value with Get Well, not only acquiring, but then integrating a number of different solutions into what has really become much more a singular patient consumer platform that very nicely interoperates and complements our EHR here at LifeBridge Health. So when you look across our key acute care sites, you'll see that we have inpatient deployed, and really 3 of the sites that occurred relatively recently over the last 3 years. Big investment, big push, but that really the majority of this activity has really become much more accelerated over the last 4 years. Rounds Plus is used by all of our clinicians multiple times a day as they do their interdisciplinary rounds. Guided care, as Royce mentioned, these are those previously called health loops. And although this slide indicates that they're tethered sort of to a hospital swim lane, and we are using them for ER discharged patients and all of our inpatient discharges, we also have guided care paths in place for a number of our physician practice specialties. And then maybe a little bit unique to us, but Dove and Bridging Life are actually our hospice partner, our joint venture partner here in hospice care that's very integral with our acute care delivery to the community. But when they saw the benefit and actually felt the value that many of our patients had taken advantage of while visiting one of our acute facilities, they raised their hand and said, please, can we add this value to our residents and our patients? So this really just represents the deployment. I think what's really important here, because one size doesn't fit all, and all of our hospitals are different and all of their needs are different, these haven't remained static over that time period. As LifeBridge has identified new goals, new places to conquer, or frankly, new areas, largely in the patient experience realm, we've partnered with Get Well to accelerate and push on how we can use those tools across the system to achieve those goals. What I think is important here, and Royce mentioned it, around the integration elements, everyone who's on this call understands right now we have a real acute workforce shortage in healthcare, and where that technology integration can assist is just invaluable. Across all of our hospitals, when our patients complete their education, that information goes back and updates our EMR. So those nursing assessments and those nurses don't have to redocument that education was completed. And in fact, they easily now see that in the Oracle Cerner EMR. And our consumers are going to the consumer framework and able to get their updates for any of their Get Well guided care experiences.